My name is Susan Leclair. I recently retired from the University of Massachusetts Dartmouth as a Chancellor Professor in the Department of Medical Laboratory Science. I taught a course for non-science majors. I understood medicalese fairly well, but using it in front of a class of 19-year-olds, no. So I went online to see if there was something out there that could connect with them in some way. And I found this listserv. It's a kind of a bulletin board, and people were posting things and answering back, and they were telling their stories. The MPN Listserv is a community. It's a community of people who have got these diseases, who have come together to help each other live through it and live better lives through it. There are patients, there are husbands and wives and children of people who have these diseases who want to be informed, and they would say things on this listserv. You know, my hemoglobin's going up. Should I be panicked about this? And it was just really easy to say, no, in English, this is what this means. And the person who was in charge of the list, she wrote back to me and said, so you want to be on this constantly? Because we have questions, and there's nobody on this list who can answer them. That's how it all happened. It was really serendipity. The first week, I think I got 1 or 2 questions. Now, 18, 19 years later, we have about 50 people throughout the week, answering 40, 50,000 questions a year. The first thing that I will tell an MPN patient is take a deep breath. You know this is a horrible thing for you to hear, but you are not alone. There's tons of people on this list. We can all get everybody through this. The things that I say are very practical. You know, bring somebody with you, have a tape recorder. I don't know what to say to my physician. Here are the questions that you should ask him, and this is in a kind of a language he will understand. Because then you get to be a really good patient. I think part of that becoming a better patient is that you learn what you know and what you don't know, and you feel comfortable in asking questions and in maybe criticizing or pushing the envelope of the discussion, and that is empowering to people.
We have multiple classifications.
You sit up straighter. You are more comfortable in your own skin, and so you become in charge of your own life. Older generations would get bad news, they would cry, they would go to their church, and they would do whatever the physician said. Younger generations don't do that. They get bad news, they cry, they go online, they understand, I think, intrinsically that they need more. And I can give them that. My team for the American Society for Clinical Laboratory Science can give them more. And this is what makes it both a challenge and a joy. And I think it is critical to good medicine.